Welcome to Adapting class. This is part 2 of the Psych Mental Health Nursing Pharmacology that I did. I don't want you to miss any question on Psych Pharmacology. So this is a video you want to watch, and I'm glad you selected it. Stick around, learn some test-taking skills and high-yield facts on psych medication. And let's do some questions, about 20 questions. Let's go. First question, as usual, try to create questions to keep you thinking. So this is a very good question. Let's get to it and see. It's a select or apply. It's a content I want you to apply. And Nancy is caring for a client with schizophrenia on Clozapine. Which of the following lab work need immediate intervention? The lab work that need immediate intervention on Clozapine. You know, one of the side effects of this is what? Agranulocytosis, right? What does that mean? There's numbers you have to know. What do you mean by that? That to answer this question, if you don't know, it's a content. Your WBC should be greater than 30 and should be greater than 2,000 about you, even if you're on Clozapine. But if you go below this, I'm worried about you. This is fine, right? This is fine. This ANC, it's less than 2,000. I'm worried about you. ANC is 2,000. It should be greater, right? And the VBC is right at 35. I want it to be greater than 35. Numbers you need to know. One down. Case form, I don't want to give you a full case, but this is the way I'm trying to get you thinking, in a case form, right? So what do we have? What medication the nurse suspect? That means there's a medication causing some problem. A female client was brought in by family after emptying, overdose the bottle for it. So the medication has to be depression. So I'm using test-taking skills. Medications, took all the medication for depression. What do you see? Temperature 98, tachycardia, blood pressure slightly elevated. What? Lethargic. I'm drowsy. My mucous memory is dry. My pupil is dilated. My bladder is full. Did you see something here? Pathways, we call it. Cardiac monitor show what? Prolonged PR interval. What do you see? Patient took depression medication, and we have what? An anticholinergic effect. That's dry mouth, dilated pupil, bladder full. We have neurological problem, lethargic and drowsy. We have cardiac problem, right? These are all telling you that this is a TCA. In a TCA, you're talking about dance, right? They have dermatitis, anticholinergic, neurological, cardiac, and then you evaluate. So phenoxin is what? MAOI is not. Paroxetine is SSRI. Nortriptyline is a TCA. And sertraline is a MAOI. So somebody is here. This is the problem. Okay? So that's nortriptyline. Number 2. Number 3 question. Select or apply. Which of the following medication the nurse should question? I need to question one of it. A nurse is caring for a client on lithium for bipolar. Client has history of what? Hypertension and osteoarthritis. So patient is on lithium for bipolar. At the same time, has hypertension and osteoarthritis. We got to manage this medication. So as I do this question, you can pause it, answer it, and see what I say. And then you pause it, then you answer yourself, then you listen to me. So hypertension, what? Osteoarthritis. But the patient is on lithium. Like we should not take anything that can affect lithium. How? Kidney. Anything that affects the kidney or cause dehydration will cause a problem. This is how you do content in terms of question, right? Acetaminophen does not affect your kidney or cause dehydration. Motrin, it does. affect the kidney. And Enalapril, what does it do? It decreases your sodium. That's how it helps with your blood pressure. And when sodium is low, lithium go hayward. So hesi inhibitor should be contraindicated in the bipolar patient. Clothianidone is hydrochlorothiazide. It causes dehydration, causes hyponatremia. Therefore, this aspirin does not do anything. So if they ask you, what are the 3 drugs you should avoid in bipolar patient? Is NSAIDs, ACE inhibitor, and then diuretics. Okay, so those are the things you should avoid. 2, 3, 4. Next question. Highlighted form, trying to be fancy, right? And this is caring for a client with newly diagnosed new depression, right? The client has a history of what? Asthma, diabetes, hyperlipidemia, pheochromocytoma. Which of the highlighted diagnoses need priority intervention if the client was prescribed tricyclopramide? What do you think? This medication is what? Is MAOIs. MAOIs, they are notorious for hypertensive emergency. So you should not take anything that will cause hypertensive urgency in these patients. You should avoid it as much as possible. So which of these medical problems you should avoid while you're taking this? Asthma, there's nothing that will relate to hypertensive. Diabetes doesn't do that. Hyperlipidemia, yeah. But fuel, what is the fuel? The 5 F's or 4 F's of fuel. They have hypertension, they have headache, they have hyperhidrosis, okay, you have hypermetabolic activity, high blood pressure. It's a problem for them. And when you have what? Taking MOIs, you should avoid in the patient who has pheochromocytoma. They're going to have hypertensive emergency. So which of the highlighted diagnoses need priority intervention if client was prescribed this? Is my boy, pheochromocytoma. Nice question. Next question, number 5. Which of the following medication, same thing, it's all fine, is the culprit? That means it's the problem. And diagnosis, the nurse will document. The culprit and the diagnosis, it will document. What is the problem? A client with known depression, yes, depression, present to the clinic with evaluation. During assessment, the client unconsciously clenched the teeth. What do you think? Clenching of your teeth unconsciously. The client's spouse reports similar episode when they are asleep. Do the same thing. What do you think? This is content. That's why you have to master your content really well. And I want to bring this new content. If you've never heard it before, SSRI are notorious for causing these symptoms. We call it Bruxism, clenching of your teeth unconsciously. We know Bruxism is that texts are not usually necks and move in one direction and stay there, but it has nothing to do with clenching of the teeth. So we know test taking skills. The answer has to be Bruxism. So I would take 2 and 4 out. I'm not even looking at it. Now I make a diagnosis. All I need to see is whether this is SSRI or not. And this is MOI. So the only thing that is SSRI is number 3. So that's the answer. So the symptoms is Bruxism, and the problem is for the SSRI medication, fluoxetine. So you need to open the patient, put a bite block in the patient mouth, change to another medication or a lower dose. So that's key. Number 6, what do we have? Which of the following, you can see me, I keep on reading from the back so that I can figure out what is going on, rewrite the question, analyze it, and pick the answer choice. Which of the following order the nurse should anticipate? So which one should I anticipate? And nurse is caring for a client with what? Acute mania. So I'm in mania episode. What is the problem? Cool me down, brother. Cool me down. That's all. So which medication I should expect? Bupropion is antidepressant. Think about it. This is I thought about this question when I was making it because I think it just occurred. Like, I think it's a good question. Depression patient, you give them antidepressant. What do they happen? They get energy. They have two-man energy. That's where you want to give them. They down, we want to give them a lot of energy. This will make this guy, maniac patient, be on top more. So it's going to worsen. So antidepressant sometimes can worsen maniac episode. Okay. Fluphenazine is what? First generation typical and antipsychotic, but it's not used as the first line for mania, acute mania. What do you use for mania? A mood stabilizer. I like to use this word rather than using lithium. Mood stabilizer. So if you see a mood stabilizer here, pick it. This is an NSAID. Ketorolac is an NSAID. It's not a mood stabilizer. Most of the mood stabilizers are usually anti-epileptic, seizure medication, valproic acid, carbamazepine, phenytoin. They are all. So thus is the treatment for acute mania. You can give them carbamazepine. They're not going to give you lithium and all those things because they know, everybody knows that. So the right answer is what? Carbamazepine. It's a mood stabilizer. Next question. Long case. Select all that apply. This, I just want to show you a content. And this is caring for a client who is not tolerating the oral MAF. Okay. Oral ziprasidone. You give the patient ziprasidone, and you have to recognize ziprasidone is antipsychotic, right? Due to dysphagia, you can swallow well. The pharmacy does not have, there's no injectable, so there's no IM form. You got to give them something by mouth, even though they can't swallow. How do you do that? If I can't swallow, you can still put things in my mouth, something that can dissolve easily, something that is sublingual. So which of the following the nurse will expect the physician will order? This one you just have to know. So I want to give it to you. Clozapine, it come in, it will disintegrate in your mouth. You put it in your mouth, there's a form that can just break into pieces in your mouth and you get to absorb it. So this will be good. Aripiprazole. This one come in sublingual, so we can give it to him. Quetiapine usually is oral, so there's no way we can give you this. Loxapine also can disintegrate in your mouth, and asanipine. These are all second generation. It can also disintegrate in your mouth. So 1, 2, 4, and 5 are the right answer in terms of the drug formulation. Just to give you some content if you've never seen it before. Next question. Select or apply. Which of the following statements need immediate intervention by the charge nurse? That means something is wrong here. A nurse is providing teaching to a client who is scheduled for what? Electroconvulsive therapy. I'm going to have ECT, okay? And this is used for depression. There's certain things you should know, okay? When you're going to have this medication, they should continue to take their antidepressant. So hold your fluoxetine the day of procedure. No, you're already depressed and you have refractory disease. You should not stop your medication, so you still get it. Take your hydrochlorothiazide the day of surgery. Yeah, there's no need for you to stop your blood pressure medication. It does not affect the procedure, so this is good. Hold Clozapine 1 day before the procedure. This is your antipsychotic. We don't want you to be in a maniac episode or psychosis when this is going on. I want you to take your Clozapine even the day of the procedure. So which of these need immediate intervention? This one. So I'm going to put it. So this one is good. I'm putting S as the bad one. So this need intervention. Hold, hold this is a bad one. Take your Voprate, the Voprate the day of surgery. The same thing. I don't want you to have seizures. So take this, but the key fact here is we're going to induce seizure. Okay, so we're going to induce seizures, right? This is the key. That's how you have to think critically. I don't want you to have seizure, right? But I'm going to induce some seizure for the procedure. If you take your Voprate the day of the procedure, you make my threshold to initiate seizure is very high. So it will be very, very difficult for me to get it. It will affect the procedure. So this we need to intervene. Okay, we need to intervene. They should not take it because when they take it, the ability to induce seizure will be affected. So we don't want to increase the seizure threshold. So this is going to increase the threshold for seizure creation is very high if they incorporate. So that's it. Bring an escort the day of the surgery. So this is good. So who do I need to intervene? Is one, holding your SSRI, two, holding your Clozapine, three, taking your Voprate because the Voprate will affect the study exactly related to seizure. That one is a little bit hard, so you got to think hard. Another highlighted priority. Which of the highlighted information will make the nurse to intervene with the prescribed medication? I'm going to intervene. A client presents to the mental health clinic for evaluation of depression, has a depression. Patient has a history of what? Head injury 1 year ago. He smoked half a pack. He has erectile dysfunction. He has epilepsy. The client was prescribed what? Bupropion. After evaluation, which of the following highlighted need intervention? So bupropion, this is one of the, you got to know this. Antidepressant, that is very good. It has the side effect, sexual dysfunction is zero. No, you don't have it at all. Okay. But the problem is it can be used to help with smoking. So you can help it decrease the craving for smoking. And two, three, it decreases your seizure threshold. So it can increase your ability to develop seizures really bad. So, and it also give you a lot of energy that decrease your appetite. So it decrease your appetite to give you a lot of energy. Um, it decrease your seizure threshold, smoking, and that. Patient had a head injury before, yeah, we don't want them. It's a risk factor. They may have more seizures with that. So I need to intervene for this one. Smoking cessation, yeah, if you smoke, yeah, this may help with that. So it should not be a problem. Rectal dysfunction, it does not affect your sexual function. So it's good. Epilepsy, patient who has epilepsy, now you're giving them bupropion is going to decrease your seizure threshold. You will have more seizures. So the one you need to intervene regarding diagnosis is epilepsy and the history of a head injury. Number 10. Which of the following the nurse should anticipate as the food source, right? A client presents to the emergency room, headache, nausea, heart rate of 110, blood pressure really high. After a cookout, client does not remember what was served. I don't know what I eat. Client has a history of depression, right? But he take what? Isocarbazide. This is what? MAOI, right? So you have to rewrite the whole thing. I have depression. I take an MOI. I went to a party. When I eat something, all of a sudden, I have headache. I have nausea. I have tachycardia. Look at my blood pressure, really high. What do you think? This is hypertensive urgency. So I have to eat something that I'm not supposed to eat. What is that? MOI should avoid Tyramine food. Which of these has Tyramine? Is that avocado? Smoked fish, yeah, if this were to be smoked fish, that would be a problem. But avocado is the problem. He went to avocadian, and that's why he's sick now. Number 11. When initiating a plan of care, which of the following is a priority? Which one? The client with the history of schizophrenia is on what? Clozapine. Which one is a priority? This has a bunch of side effects. It causes what? QT prolongation. It causes what? Agranulocytosis. It causes hyperglycemia. It causes what? Orthostatic hypotension. You have to be sharp. Which of those can kill the patient very shortly? You have time for QT prolongation. It can progress from QT, different changes in EKG. But do you have time with this severe sepsis? This is deadly sepsis. Hyperglycemia is not the problem. Orthostatic, just get up slowly. This is a good question for B-sharp. So this I can teach you to take care of. Hyperglycemia, yeah, I'm not worried. I will B-sharp talk about hypoglycemia. I have time for QT changes in the EKG. But sepsis with this bad sepsis, yeah. So this is your right answer. Number 2. It's a trap answer. I know a lot of people will pick 1. Number 12. What do you think? Sata, which of the following orders the nurse should question? Something is wrong. I don't like it. I need to question. A nurse is caring for a client admitted for severe complication for anorexia. So if you are anorexia and you have severe malnutrition admitted, probably we got to feed you. Physical need is important. So hydration is good. Replacing electrolytes is a physical need. Cardiac monitor, they have hypokalemia, right? K is low, therefore I got to watch you up. Metaphenidate, what do you think? Think about it. What is the side effect of this? This decrease your appetite. Do you want anorexic patient to have a decreased appetite? Oh God, you're not going to eat anything anymore. So we should avoid metaphenidate in anorexic patient because they're not going to eat. Same thing as bupropion, okay? Does decrease your appetite. Therefore, you should avoid it in anorexic patient. Fluoxetine, oh my God. These two decrease your appetite, so it make you lose weight. But fluoxetine, like the major side effect is weight gain. Well, I want my anorexic patient to gain weight. Even if they eat small calorie, you're going to gain weight from it. So which of these I should question 4 and 5? Next question. Which medication the nurse should anticipate the physician will prescribe? So what would I anticipate? A client with schizophrenia present to the mental health clinic. Client report of excessive what? Weight gain. Is getting too much weight gain, about 40 pounds in a month. While in quetiapine, it's SSRI, antipsychotics, second generation, right? Client is requesting another medication. What do you want to put in? This one you have to know. This is sometimes considered as a third generation. They're part of the third group. But you can consider them second, but under the second, there's a group of 3. This one, aripiprazole. Among all of them, this one is like less sexual dysfunction, less granulocytosis, less weight. So the patient is gaining weight too much, we give the patient this one, aripiprazole. It's much better. So, number 14. Which priority medication the nurse anticipates? That means there's a medication that I need to give to this patient. A nurse administer Loxapine to a client due to agitation. The client begins to draw, and pace around the room after 4 hours of the medication. What do you think? I give you Loxapine. What is that? This is first generation antipsychotic, right? All of a sudden, you're doing what? You draw and you pacing. What do you think? Pacing is akathisia. Drawing is what? Parkinsonism. People who have Parkinsonism, they draw, they pill rolling, they have tremor, rigidity. Parkinsonism, akathisia is a form of what? Extrapyramidal side effect. So how do you treat? This is what the question is asking. You have to put it together like I did. How do you do extrapyramidal side effect? Give them anticholinergic. If they give you a question, all you need to do is which one is a true anticholinergic? Not this one, not this one, not this one. It's that guy. This, you cannot give him that because this is the same as first generation, right? Clozapine is also antipsychotic. I cannot give you, and this is SSRI. So diphenhydramine, which is Benadryl, is usually good for extrapyramidal side effect. Don't forget that fact. Extrapyramidal side effect, you can use you can use benztropine, amantadine, you can use diphenhydramine. It's very good for that due to the anticholinergic effect. Number 15. Which medication the nurse should anticipate the provider will prescribe, select and apply, right? The client with schizophrenia present to the mental health clinic with evaluation of after 2 months of trifluoperazine. That is what? Antipsychotic, first generation. Assessment reveal, this is what I was telling you about. Rigidity, I have tremor, and I'm very slow. Bradykinesia when I walk. Tremor, rigidity, I'm very slow. What do you think? This is what we call Parkinsonism. So it's acting like a Parkinson disease due to the extrapyramidal side effect by trifluoperazine. Therefore, what do you give to that patient? All you need is anticholinergic. So benztropine is good. Amantadine is also has anticholinergic effect. We saw diphenhydramine is good. This is another antipsychotic. You can give it to them and try esophageal. It's another medication. This slide, you should take a picture of it and have it with you whenever, and keep on looking at it. Every time you see question, you should remember there's 4 drugs that is used for extrapyramidal side effect: benztropine, amantadine, diphenhydramine, and triacylphenylidine. Okay, for extrapyramidal side effect. Number 16. This is also a content I wanted to show you in case you don't know. And this is caring for 4 clients who need immediate intervention. So for this, the keyword is if you are on MAOIs, right? Then you want to go to SSRI. You want to change to SSRI. You need just 2 weeks. 14 days is good. But if you're moving from SSRI to MAOIs, you need 5 weeks. Because of the mechanism and neurotransmitter effect of that, it takes a long time with that medication. So if I'm changing from MOI to SSRI, I just need 2 weeks, right? And if you're going from SSRI to MOIs, you need 5 weeks. So what do we have? History of depression on fluoxetine, change to selegiline. So you move to SSRI to MOI in 5 weeks. So this is good. B, history of depression on fluoxetine, change to selegiline in 6 weeks. Yeah, 6 weeks is good. History of depression moving from MOIs to what? To SSRI 2 weeks. So that's good. Issue of selegiline, MOI changing to fluoxetine 1 week. So this you say 1 week. 1 week after stopping the medication. This is wrong. 1 week is not enough. You need 14 days. So that's what I wanted to teach you. Which of these clients need immediate intervention? You have to be sharp. It's all psych by being sharp. Client on Bupropion, we've seen him multiple times for depression. Complain of can't sleep. Yes, because that's what it's for, to keep you awake from your depression. Client on lithium for bipolar, prescribe fluoxetine. I told you, SSRI are not good. They will increase your energy more, and that bipolar doesn't need any more energy than they have already. Client on Dysparvine for depression. This is what TCA, which has anticholinergic effect. Client complaint of constipation. Well, that's what is expected. Client on Clozapine for psychosis. Okay, but what is the Y count? 4,000. You just need greater than 35,000. Just because it's 4,000 doesn't mean it's bad. That's normal in the lower side. But for Clozapine, we want the BBC to be less than 35,000. If it's greater than 35,000, 3,500, yeah, then that means 3,500, 3,500, yeah, then I'm good. So this one is good. So don't choose it just because it's Clozapine. Look at these numbers just to get your attention. The only one that need intervention is number 2. So don't choose number 4. Okay, home stretch. Two more questions. Who do you see first? Client on citalopram, that's SSRI, complaint of drowsiness. Yeah, expected. Client on fluoxetine, okay. Erectile dysfunction, yeah, very common. Client on sertraline, he said he has gained weight. Yes, that's fine. These are SSRI. Client on escitalopram, complaint of tremor and anxiety. I don't like this. This is like, it looks like symptoms going on. Serotonin syndrome. So this one. Number 19, almost done. What is the question? Select or apply. A client was prescribed Vilazodone. This is antidepressant. For depression, you see, I've given it to you. Which medication clients should avoid for pain management? If I have pain, I have depression, I take this. Which of this I should avoid when I'm taking Vilazodone? I've rewrote the question. So which medication clients should avoid for pain when it? Key thing, remember this, Vilazodone is also a serotonin, it blocks serotonin. So it increases your serotonin. If you take anything that increases your serotonin too much, you go into serotonin syndrome. So Motrin does not do that. Tramadol increases your serotonin. Amitriptyline, this is migraine medication, also increases your serotonin. Acetaminophen does not do that. Aspirin does not do that. So Tramadol and sumatriptan is the key. And the last question, the bonus question. Which symptoms the nurse should monitor first? Which one should you monitor first? A nurse administers Adderall to a client for agitation. acute dystonia, akathisia, Parkinsonism, and tachydyskinesia. The first problem is acute dystonia. That can occur just within a few hours, between 4 or 5 hours later after you inject this medication in a few days. So it's the number one that you have to watch for after you inject antipsychotic in the patient. So this is the end. You see this giving you some good content so that you can have it at the back in case you see questions like that. All the best of luck. Look down and subscribe and follow up with the Adapt NCLEX on YouTube. All the best of luck and keep charging as always. Never stop charging. Bye-bye.